Good afternoon and welcome to another edition of the CannaList Conversation. We're here today with Peter Homberg. Peter is a partner at Dentons in the Berlin office. He is also head of their life science and cannabis sectors. Peter, welcome. How are you?
I'm fine. Thank you so much for the invitation.
Absolutely. Peter, I know that you're a life science guy that goes way back. How did you manage to transition into cannabis?
Well, I have been in the pharmaceutical and diagnostics industry for many years before I joined private practice again. I was working for Boehringer Mannheim Roche Diagnostics for many years as the deputy head of the legal department, and then went into private practice again, first at Jones Day, where I started to build up their European life sciences practice, and then now with Dentons, where I'm heading the German life sciences practice and the European cannabis practice group. When the liberalization back in 2017 in Germany took place, it was the question, how can we serve our clients best? And as the main purpose for the liberalization of cannabis was the medicinal use, it was kind of logic that the life sciences practice, my practice, is actually taking care of that. Since then, we are working very closely together with our life sciences, but in particular the cannabis practice groups in Canada and in the US, which are quite big. And we took it from there. We had clients from Canada early in 2017 who already started M&A transactions in order to get a foothold into the German market for their medicinal cannabis products. And it was kind of natural that a life sciences guy like me actually is working also in this field, which is at this point in time pure medicinal cannabis.
So, I mean, you entered the market, like you said, after the 2017, things have been moving really fast in Germany, especially in recent months with the announcement that the new government is looking to move to adult use. So what are some of the challenges you see in the rollout of this new administration?
The real challenges are those which have not been really thought about. I think the plan to liberalize cannabis also for the recreational use comes naturally with the three parties, the Liberal Party, the Social Democratic Party, and the Green parties. They all had the liberalization of cannabis for the recreational purposes in their respective election programs. And now, as you know, yesterday, Olaf Scholz became the new chancellor and the new government started working. They have now to implement that. And it is actually part of the so-called coalition treaty, which is an agreement between the three parties, how they would like to go for the next 4 years. Now the question is, how can they really implement the liberalization of recreational cannabis in Germany, which is really an issue. I think the real challenges are to overcome the restrictions of the 1961 UN Single Convention, which does not allow any kind of transfer of narcotics, and cannabis is still within the definition of narcotics under this convention, shall not take place for recreational purposes. Yes, for scientific purposes, yes, for the medicinal purposes, but not for recreational purposes. In all countries who have actually liberalized the use of cannabis for recreational purposes have their own cultivation. They are cultivating cannabis for recreational purposes in their respective countries for domestic use, be it Holland, be it Canada, be it the US, some states in the US at least, and Uruguay. So that's a real challenge, how this should be handled by the new government.
And is that a case of changing that language, or is it a case of finding a workaround? What needs to be done?
Well, changing domestic legal requirements and the legal framework, for example, in the German Narcotics Act, is not really an issue. This can be done. A treaty between, I think, more than 150 countries to be changed is a real challenge. It probably will not work. So we have to look into those countries who have actually liberalized the use of cannabis for recreational purposes and how they have done that. And I think a model very close to what the Netherlands have done could work here in Germany as well. always provided that the cannabis for the recreational purposes will be grown here, because import for recreational purposes and export for recreational purposes from other countries to Germany is definitely a no-go under the 1961 Single Convention.
And to grow in Germany, would that be an indoor grow? Because, you guys are pretty far north.
Yeah, indeed, yeah. We have, of course, 3 licensees to grow and cultivate cannabis for medicinal purposes here in Germany. It was a long tender process, and Afrera, Aurora, and Demican, these three companies, have received altogether 13 licenses to cultivate specific quantities and specific lots, specific qualities of cannabis for medicinal purposes. It's only 10.4 metric tons in 4 years, which means 2.6 tons per year, which is less than around 10% probably or 15% of the total market need. The restrictions of the cultivation and how it should be done are significant. Excuse me. The security measurements, for example, for growing are significant. It must be indoor growing, coming back to your question, it must be indoor growing. And the security measurements are significant. The respective requirements for the cultivation are significant. For example, for avoiding any kind of emissions, we have very, very strict regulations which have been included in the tender documents of the BfArM, which is the German FDA. And I expect that that cannabis for recreational purposes should not be treated differently.
So it won't move to an outdoor grow or anything like that?
No.
Okay.
Outdoor is, I think, definitely out because of the climate. That's clear. Greenhouse is an issue, still an issue, because outdoors are quality. I do not expect that the quality will change in comparison to medicinal cannabis. I believe that the quality requirements for recreational cannabis will be very, very similar to that.
And does the medicinal rollout provide a roadmap for recreational use, or are we looking at a different structure?
Totally different structure. The rollout for medicinal purposes or cannabis for medicinal purposes, totally different, very, very restricted. The BfArM is going to purchase all the requirements from those 3 cultivators and then distribute this to the pharmacies. And
what is your expectation with regard to timing? I mean, we heard all the hype, but this could be years away, right? Yeah, well, let's see. The government actually, or the 3 parties who are building the government right now as a coalition, have planned to implement the respective changes legally by mid of next year. Probably that could be possible because if we domestically change our laws, that's fine. The question is, how do we get the recreational cannabis into Germany? And that's really an issue. Right. So obviously, you can make it legal, but it may be another year or 2 before you actually have product that's available in the market. Yeah, definitely. I don't believe that there are rumors, at least in the market, to make medicinal cannabis, which is available in Germany, available for recreational purposes as an OTC, over-the-counter product. This will not work. The legal framework for OTCs is very, very tight, and it doesn't really fit into that definition because, as you know, medicinal cannabis today, these products are not sold as ready-made pharmaceuticals. It is an extemporaneous mixture for the preparation of a final product. So the pharmacist actually has to do some manufacturing step on the cannabis, for example, flowers or the extracts, before they can actually hand it over to the patient. And this doesn't allow to really change the extemporaneous mixture product into an OTC product. And as you indicated, there's a fair amount of exports that have gone into the medicinal product. So that would prevent it from being used for recreational use. Sorry? I said, because you said, you're importing a fair amount of product for medicinal purposes that can't be used for adult use. That's correct. Yes, not for recreational purposes. I think that's clear from the regulatory framework right now. And of course, also from the 1961 UN Single Convention. So is this, a threat to this, or is this an opportunity for German companies to step up?
I would say it is not a short-term solution. It is not a short-term business. It will take at least a year or even longer before we will see recreational cannabis coming to the German market. We'll see how creative the new government will be in changing of first the respective domestic laws and how they will overcome the international treaties and see how they will serve the market for recreational cannabis. There are plans how they want to do it, how actually they're going to sell it to customers, under which conditions. So the kind of coffee shop example from Holland could be adopted here, though it will be definitely kind of specialized shops, dispensaries who are selling this recreational cannabis under the strict control of the government. I think that's clear. Though it should not be sold to minors. It should not. It should have a certain quality, and of course, the security measurements also in these shops should be clear.
And will Germany follow what they've done in the Netherlands, as well as where they've looked to limit, the tourist factor of the product?
Yeah, I believe that's something which they have to do, because otherwise we will have a kind of cannabis tourism as being in the middle or in the heart of Europe.
Is that a bad thing?
What happened actually to the Netherlands, a great number of tourists were traveling to the Netherlands in order to purchase cannabis there, which is now, as you know, under strict control. You have to be a Dutch citizen in order to purchase in the respective shops. You cannot use it outside the shops. You have to do that actually maybe at home, but not in public. So there are restrictions on that. And from the structure, I would say it's very interesting what the Dutch did, actually. They decriminalized cannabis, but not really liberalized it, and not allowed the use of cannabis for medicine, for recreational purposes. So it's kind of I would say they've used kind of a little bit of a gray zone of the 1961 Single Convention, very intelligently, I would say. Germany should consider to follow that route.
And will they also consider allowing people to grow their own?
I don't believe that homegrown is an alternative.
Okay. Why is that? You can't just say it and leave it there, right?
No, sure. I don't know whether you know the history behind the liberalization of cannabis for medicinal purposes. We had, before the liberalization in 2017, I would say between 600 to 800, maybe even a little bit more patients who had a specific exemption from the BfArM, the German FDA, and allowed them to use cannabis for the treatment of their disease. So it was not a real large patient population. One of those patients actually said, if I'm allowed to use it, I should be allowed to grow it. And the Germans are very good in cease and desist orders, and he got one immediately. Which stopped him from growing, and he went to court. And in 2016, actually, he won before the highest administrative court. They said, yes, you can grow. And that actually triggered the change of the law already then in March 2017, a very, very fast legalization process with changes of various provisions in different laws. And with upholding actually the stop of home grow by granting licenses to domestic growers who are then serving the German market. So take into consideration that history, I do not believe that home grow really would be allowed. And
is that to maintain standardization or quality standards? Is that the intent behind that? It's uncontrollable. Yeah, you're going to 100% lose control. And that is something which all three parties of the current government do not want. They want, yes, the use of medicinal cannabis for recreational purposes, but in a controlled way, which means they actually are looking for the respective measurements in order to control that. And they will
I wouldn't say 100%, you never say 100%, but I don't believe that they really would allow homegrown.
And do the parties look at this beyond sort of the adult use, but are they looking at this as an economic development opportunity?
Oh, yes. You wouldn't believe it. The Green Party is actually calculating significant taxes on this cannabis to be grown, to be grown in Germany and then sold for recreational purposes. They were already calculating the tax income, which is significant for that market, and they were discussing what would be the right price in order to be competitive to the black market. However, I think the major advantage in comparison to the black market is that you have a controlled quality. You know, the consumer is actually knowing what he gets, and that's I would say a significant advantage.
Absolutely, provided that it's priced, you know, competitively with what we can get in the black market.
Yeah, no, the point is also that currently the cannabis on the black market has significant side products in it, and for whatever reason, and that they are endangering the health of the consumer significantly, and that's something which also has triggered the motivation to think about liberalization, the use of recreational cannabis, and to control the quality and to put the consumer into a more or less safer environment than buying it on the black market.
Speaking of control, I saw that you posted a few weeks ago about a recall of medicinal product. What was that about?
We have, as you know, very strict quality control regulations, in particular, of course, with regard to the sale of cannabis flowers or extracts. There's the German monograph fee, which actually provides for the respective specifications of the product and in which way the quality is going to be controlled. And these products put on the market have actually a difference in the THC content. So if you are a distributor here in Germany, you apply for a distribution license for a specific product with a specific trade name and specific specifications. And that product has, which was recalled, had THC content of 20%. Which is a high THC content. Yep. The German monograph actually allows for a deviation of plus minus 10%, which means it should not be less than 18% and not more than 22%. But this lot of cannabis products had 17.9% THC content, and that has triggered the recall. For the first time, actually, because we know that there are products on the market which may even differ more than 10% from the respective application and the granted license, distribution license. So that means the German authorities are looking more and closer into the quality of the product which is marketed in Germany, and all distributors and cultivators should be aware of that.
And what about other products that are coming into the market, some questionable CBD products, and how is that being addressed?
The CBD market is a totally different market from the medicinal cannabis market, as you know. The CBD market in Germany and in Europe is relatively limited in comparison to the US and Canada, particularly to the US. We have actually three large areas where you can sell CBD products. One is cosmetics, two, food supplements, three, medicinal products. And when the European Commission made clear that any kind of product, food supplement, which contains CBD, falls under the Novel Food Directive, which was clear from the first day. Actually, if you read the respective directive, it was clear that CBD is a content which in a food supplement would need registration. Some of the distributors changed their product level, became kind of, let's say, aromatherapy. So trying to get out of the food supplement area which is, from my point of view, very difficult to argue. The authorities have currently not the respective power or not the respective staff to really go against each and every product. But as you may have heard, we had a significant recall of one of our supermarket chains, Lidl, who had to take off the shelves a number of products containing CBD and or hemp. This has been triggered by a closer control of the authorities on the CBD market. And I expect that to be even tighter in 2022.
So while they're looking to open up the market, like you said, there will be a tremendous amount of control on how that happens.
Well, the point is, what kind of impact might that have on the CBD market? Well, I think there's the interesting decision of the European Court of Justice, who actually clearly said CBD is not a narcotic. And that is a decision which has to be followed by all local authorities or all local governments of the member states of the European Union. So we hopefully will see some changes in the respective laws, which actually takes out CBD from the list of narcotics, for example, in the German Narcotics Act. It still didn't happen. So as of today, CBD is still considered under the current legal framework a narcotic in Germany, but this may change, and this will probably open the market a little bit more for CBD products. The same applies to the cosmetic field. You know, we have much tighter rules and regulations on marketing of cosmetics containing CBD in Germany than actually with, if you look into the cosmetic directive of the European Union. So I believe that the European Court of Justice decision will change that environment, not immediately, but slowly. I would say in 2022, we'll see some changes for that market as well.
And while we definitely welcome standardization across Europe, we don't even see that in Germany yet, right? Because my understanding is different jurisdictions are treating this differently.
That's true to a certain extent, yes. Actually, the European Court of Justice decision was triggered by an import of CBD products from the Czech Republic into France. And the two responsible managing directors of the company who in France, who have actually imported the products, they were actually charged, and they went against that, and they said the CBD is not a narcotic, and should be clearly stated that we should not be in any way charged for any kind of misdoing. We did everything right, and as I said, finally it is decided by the European Court of Justice, and you're right. We need to harmonize that within the European Union, how to treat medicinal cannabis, how to treat CBD products, and of course also the third large field, industrial hemp products.
And I know with the announcement of the government's position, we've seen a lot of activity in the cannabis industry, such as M&A activity. So what do you think 2022 is going to look like?
We will definitely see kind of a concentration in the cannabis market. We have currently a number of smaller companies who have a foothold in the market, who have maybe obtained the respective licenses. But there are some bigger ones who would like to get a larger share of the market. And from my point of view, we will see kind of a concentration process. We will see M&A transactions. We will see combinations, mergers in that field in Germany, probably very soon.
And do you anticipate that big cannabis will sort of take over? Like the small players won't be able to meet the standards or meet the controls, and that this will only limit the field to big players?
It's really a question of market power. And that's something which is difficult to foresee, but the big ones definitely have an advantage because they have the financial resources and they know how to move forward. And of course, quality-wise, they have very, very strict measurements in place. They can guarantee the respective quality. And the question is, where do the smaller distributors in Germany, for example, get their cannabis from? We will see some new cultivators. We will see cultivators from Portugal. We will see cultivators from Malta, not to forget Denmark, which is already cultivating, Greece, not to forget. So
but that'll be limited to the medicinal side of the business, correct?
Currently, yes. I think that's clear. Because, as I said, export for recreational purposes is 100% forbidden for all the member states of the 1961 Single Convention. So it is all planned for the medicinal market, which is growing, and of course, rightfully growing. My personal belief is that medicinal cannabis is an extraordinary addition to the currently available pharmaceuticals in various fields. Let's say, for example, for chronic pain. It helps patients to treat their disease, maybe with less side effects, very much depending on the individual. Every individual is reacting differently to a cannabis treatment. But I know a number of patients who have really changed from heavy painkillers to cannabis, and it has the respective effect. And I think that's justifying what the German government has done back in 2017 to liberalize cannabis for medicinal purposes.
And how difficult is it to obtain medicinal cannabis? I know in the US, there was sort of like, you could go to your doctor, tell him you had a headache, and he'd give you a card. What's it like in Germany?
That's different. Everything is different.
Go figure.
Yeah, we have the compulsory health insurance in Germany. So it means if you are a patient and you get a prescription for cannabis, for example, from your doctor, you need to apply to your health insurance to be reimbursed. This is a painful process, to be very frank, because you and your physician have to fill a relatively difficult form and send it to the respective health insurance company. They are looking at that and then either granting or not granting the reimbursement. Currently, 60% of all the applications are granted, 40% are not granted reimbursement. So that's the first hurdle.
That's a big number still, right?
Right, yes. The hurdle is even before. You have to convince your physician that that is a treatment which you should get. Because as long as there are other pharmaceuticals available which could be used for the treatment of your disease and which may have the same effect, the doctors to a certain extent are not obliged, but should look into whether cannabis would be the right medicinal product for the treatment of that disease. So there is the discretion of the physicians, but the physicians still are very, very, I would say, cautious in prescribing cannabis for two reasons. One, of course, the legal situation. It has to be at least, I would say, the last possible treatment after further treatments with other pharmaceuticals. But then, of course, they are not really trained to prescribe cannabis. So there needs, and that's the industry is seeing here, education of how different cannabis products work, what kind of impact they have, in order to make the physicians feel more comfortable to prescribe it. Yeah,
I mean, the other element is, the products need to go through trials so that there's, evidence-based, so that the doctors can look at evidence-based trials that demonstrate that, yes, this does have an impact on whatever you're suffering from.
Yeah, whereby we have to differentiate between these, I would say, casual trials and those clinical trials which would reach marketing authorization as a finished product. This might be difficult, if you look into the different clinical trials 2A, 2B, and clinical trial 3, you have to very clearly define the endpoints. As I said, cannabis treatments usually have a very individual effect on the respective patient, which means you have to be very selective in your patient portfolio. and you have to at least see that the endpoints which you have defined in that clinical trial can be reached. If not, your clinical trial would fail. You would not get marketing authorization. So it is discussed that at the last ICPC conference with many physicians here in Berlin. It is difficult to really define what kind of clinical trial and in which way and for which treatment and for which doses, for example, should be used. So it is I would say, you have to carefully consider whether you do this real clinical trials for marketing authorization. I agree with you. Clinical trials, let's say casual ones, which shows that there is an effect, is something which would convince physicians to prescribe the product more frequently.
And when your clients are coming to you, are they coming to you for M&A activity? Or are they coming for you to deal with, all the legislation and all of all the paperwork? Why do they seek you out? What are you seeing?
Well, we have a very broad portfolio of legal advice for this specific cannabis industry. Of course, starting with M&A transactions, also for financing rounds, but not to forget the regulatory field, which is a significant field because it's a moving target. We have changes, I would say, every 2-3 weeks, we have changes in various areas. And that's what our clients like us. We are really on the forefront here. I have a team of 8 people, and we are working, I would say, more than 50% only on cannabis related matters, and have gained over time not only very good knowledge about the legal framework, but also have established respective contacts to the respective authorities, either in the states in Germany or, of course, also with the BfArM.
And then with your other offices, you have the opportunity to, go in and out of Germany and other jurisdictions.
Yeah, well, Dentons, as you know, is relatively large, with 12,000 lawyers now
that's a lot of lawyers.
140 different locations in over 70 jurisdictions. I think we are nearly in every country in Europe. Maybe except for the northern countries like Denmark, Sweden, Finland, and so on. But we have offices, of course, in Portugal, in Spain and Italy. And yes, I have also colleagues in these jurisdictions who are following the local changes of the laws for cannabis. And we'll see definitely changes in the other European countries soon. Also next year. And if really Germany decides to liberalize cannabis for recreational purposes, then we will see other countries looking into that. And we had already kind of a pulling effect back from 2017 with regard to the medicinal purposes. We probably see that also then for the recreational use.
Yeah, once the dominoes start to fall, right?
Right.
So beyond the challenges that we're facing in actually implementing adult use or recreational use, what do you see going on in 2022?
Well, what we need, and I have actually together with my colleagues established an association, which is the European Cannabis Association, is an harmonization of the legal framework for medicinal cannabis within the European Union. It cannot be the case that each and every country within the European Union is treating the use of medicinal cannabis differently. Germany has demonstrated that it can control, it can definitely, without any doubts, allow the use of medicinal cannabis and control it and get it to the patient. This is not possible in other countries. If a patient now travels to France, he has difficulties with respect to using his medicinal cannabis products. He won't get it there, which needs harmonization very quickly. We need to have a European directive on the use of medicinal cannabis, which is applicable to all European countries or all countries within the European Union. And the ECA and my colleagues, we are working on that, on the harmonization of the respective legal framework, but also on the quality framework, because each and every country is also differently interpreting EU GMP. and we need that also with respect to the business conduct. We need to have rules of how and in which way the cannabis industry should conduct their business within the European Union.
Well, Peter, we very much appreciate your time today and your insights. We will add some of the links to Dentons and your organizations that you mentioned so that people can get more information. We appreciate your time and keep up the good fight.
Thank you very much, Patrick. It was my pleasure.
Absolutely. Thank you, sir.
Thank you. Bye-bye.